So now we're trying to look at for you to be able to interact with a patient successfully as a radiologist, what are the skills you need? Okay, for you to be able to interact with the patient as a radiologist, what are the skills that you need? You know, what are the basic skills, so to say? So, what we got here is this. So, first of all, it requires a lot of skills, right? Now, these are the skills that we'll be looking at. These are the skills that we'll be looking at. So, key principles of patient interaction in radiology include, first of all, you have to just make sure that your communication is clear. Okay, you have to make sure that your communication is very clear. So you outline what the patient expects. Okay, you encourage the patient in actually asking questions too. You're not there to act like a boss, but you're there to make things easier for the patient. Then what next? You also encourage empathy and compassion. Like you're simply trying to put yourself in the shoes of the patient and just try to consider them. You are trying to recognize that many patients, they feel a lot of anxiousness and they feel vulnerable at that stage, so you are trying to be kind. Then for professionalism, you are trying to just maintain everything on a professional level. Okay, you're trying to use all those appropriate touching and positioning. You're trying to be respectful. Okay, so tailored approach to different groups. What you do to a baby is different as what you do to an adult. All those kind of things. So children, you use what appropriate explanation and visual aids. You also involve their parents in it. Then sometimes you might actually want to use all those toys that will distract them away from always just feeling as if there'll be pain, there'll be pain, there'll be pain. Then for elderly patients, you have to actually speak slowly. I have to speak clearly. You have to explain everything in detail. So for patients with disabilities, you have to adapt all those communication methods. Ensure that they know everything that is happening. Respect what autonomy. So last is the patients that will be able to say yes or no. Then also you're trying to look at the place where you actually find yourself. You're trying to respect the culture there, and you're just trying to make sure that everything is nice. So I think that's what we got for the various skills that you have to actually have for you to successfully, so to say, deal with patients, in a radiology lab.